record on this computer here, and yeah, now it's recording here whenever the thing says. And okay, so now that things are rolling, I just wanted to take the time to introduce ourselves. I'm Harold, and we also have with us Cristina Perillo.
How's it going,
And
Rick?
did I pronounce that right?
Yeah, you did. You did.
Okay.
So,
Okay. And we started the Explain and Change Your Pain Facebook group out of some of the experiences we've had as clinicians and student clinicians. And we wanted to open up some resources to mainly patients who are trying to find answers that actually make sense to them and can give them some hope, give them some clarity for their pain, and try to just dig themselves out of any sort of mess they might find themselves in. The secondary goal for this is to find a way to help clinicians and just disrupt the state of the healthcare and wellness industry in a way that will enable us to be better providers and just take a lot of our own egos out of the equation, take our own doctrine
mhm.
out just enough where we can open the floor up to collaborative care, to actually being patient focused instead of being so much focused on feeding the system. And there's a lot of faults at play here. But Christina, you want to do a quick little intro, and then I wanted to ask you a couple questions.
Yeah. So, I'm a new grad physical therapist. So, I'm really just within my first year of practice, currently in an outpatient clinic. But I mean, really, what interested me in, combining this knowledge of what we call pain science with not just what we know with the biological model, but really like psychologically and socially. So, from what I've seen rotation wise and currently what I'm seeing in this very clinic that I'm in is that there's like clearly a gap between what we know as physical therapists in terms of how we view pain and its relationship with you socially as well as psychologically, and really a gap between that and what patients know. So, I think really our goal and our effort is to almost bridge the gap between the two. And knowing that, we're hoping to really start to improve outcomes, especially with patients that have, long-term chronic pain. So that's just a little bit about me. Harold, do you want to tell them a little bit about yourself also?
Yeah, absolutely. So I've been in practice I've been practicing as a clinician for about 3 years now, I want to say. And my own personal background in all of this is really just actually when I started out as a green clinician. I started out in I think I have a lot of respect for the people that I've worked for and the way that they've set things up. But one thing that I was having a lot of trouble with, and I think a lot of clinicians do struggle with this on some level, and a lot of patients struggle with this, is the fact that it's hard to compromise, make some compromises in the clinic where you can see enough enough patients to be able to keep your lights on and maintain the clinic, but also deliver effective care. And this just turns into more volume than anything. And I've learned a lot of things along the way. Um, Ask me to clarify anything along the way. I'm kind of spitballing a couple of these things that just I came across. But one of the things that I learned as a first year clinician was, okay, I'm starting to see some patients with HMO insurances, 4 per hour here. That's the designation. It doesn't necessarily mean that I spend any less time on them, but I might spend less attention on them. And there's a lot of stories that are attached to their history. There's of a lot of emotional pain behind their physical pain, and a lot of that can be missed when you don't get to devote your attention to them. And because of that, we tend to simplify things. We oversimplify people into diagnoses, and then like, oh, this is a low back, this is a knee, this is a shoulder, this is a neck, this is a motor vehicle accident. it's it is easier and more convenient communicating with each other as providers, but it's really unfair for our patients because it's we don't see the other part of the story. We don't see that this has been a problem for 10, 20 years. We don't see that this has created a workplace problem or problems with a family. um, this has disrupted their way of living and has taken a lot of hope away. And then maybe it might not have created emotional problems like depression and anxiety, but it may have amplified and created triggers there. And then the people that I've been seeing, they start to have a spiral of frustration, and it becomes harder as a clinician also. So last year, I actually found some very smart people that I learned from through some mentorship on how do you treat people who are having what we call chronic pain, which is pain that you've been having for a long time. How do you address different sects of people with more systemic issues like fibromyalgia pain, um, or things like rheumatoid arthritis or lupus? Those are factors that can amplify otherwise ordinary musculoskeletal diagnosis and normal, a problem that might just be a bump in the road that can take longer when these things are come along the way. But what a lot of my takeaways were, they're very similar to what you mentioned, Christina, in terms of looking at the whole person and going beyond the biological approach. Um, I actually wanted to put throw that back at you, Christina. What motivated you to look at these people in particular as someone that you wanted to focus on?
Yeah, I mean, I guess the truth about pain is that it is so complex. It's not as, black and white or clear cut as we think it is. And there's actually a lot of gray area. And I think really as kind of like healthcare providers, we honestly don't really quite understand it, but it is starting to become something that we know a little bit more of, but we're not exactly sure what does cause pain. So, I'm really just hoping that by starting this platform, which I think will allow us to help patients with chronic pain or long-term pain a little bit better, and in an effort that we can, dispel some of those myths that are out there, maybe navigate some conflicting information, and really just start having a good conversation about it. So really learning on our end on how to approach it, but also, providing the information that we know to you guys and letting you guys make of it what you will. But it's really in an effort to help manage pain is what I'm saying. So, it's a population that does need a little bit more attention than I think what we're accustomed to getting when we're in a clinic. So, this to me would be like the perfect platform for that.
Yeah, you said a lot of great things in there that I really agree with. You mentioned that this is more of an effort to help people manage their pain, and we're not talking about just like pain management from a medical standpoint, right? Why don't we try to explain what that is for a little bit, and we can take other time, make time for doing a deeper dive into what pain management really is. But in your experience, what does pain management really mean for you and for your patients?
Yeah. So I think, I mean, the very root of pain management is more having patient-centered goals. So really identifying what the patient wants to get back to, because it's not the same for everyone. They can have different goals, whether that be I want to walk more, I want to run, I want to be able to just play with my grandkids. So really taking those goals and offering different ways to help reach those goals. So whether it's something, we'll go back to our basics. So exercise. How can we make exercise more to be about movement as opposed to here's a bridge or go ride a bike. How can we make it tailored towards patients and individuals, and even down to like just holistic intervention? So meditation, yoga, other aspects of care that we may not think of, but research has shown that it can be proven to help reduce some of that pain. So you know that's just what I'm gathering my early career. But Harold, do you have any extra things you want to throw in there? Anything else that has helped you?
100%. And again, things like meditation, yoga, they are a lot of
Hmm.
principles that are just missed that I've seen in the clinic. And I'm not trying to throw anyone under the bus here, by the way. Everyone's doing their best and they mean the
Hmm.
best here. Um, but it doesn't hurt to borrow concepts from other fields.
Right. Yeah, I agree.
Um, and it definitely doesn't hurt to do your homework and do the research.
Hmm.
And as professionals here, we've spent a lot of time in school, but we can still continue to put in the time to um, take out quality research and current research and integrate that into what we do, and
Hmm.
also communicate it effectively. Um, you Things like riding a bicycle, doing a bridge, they're actually really good things. They're fantastic things. But when we at least I know I have overprescribed exercises, like, oh, do 30 of these and 30 of those, and there's like a list of 10 exercises, even like list of 5 exercises. It becomes really overwhelming for somebody who has had a lot happen to them, who
Hmm.
and then like a cascade of other events. And there are a lot of solutions to the problem, but it's more that there needs to be someone to validate what they know and they've experienced, and then show them a new way here. And hopefully we can show them that there are a variety of options,
Hmm.
and also provide a platform where our people here, our patients and clients, and just anyone who's curious, anyone who's been having these problems, they can voice their frustrations, but also voice them to someone who has some experience in this area, and can I don't think I know everything. In fact, there's too much that I don't know,
Hmm.
but we are connected to people that are experts in their own um,
In their own field,
respective
yeah.
fields here. And I think that just by connecting the dots for our patients, um, they can find answers, and we could just show them the way. We can highlight the path here, and in the process, we learn more, and we learn how to better deliver these things.
Right. Definitely. I agree 100%. I mean, um, you're right. It's really just about connecting the dots. There's a lot of stuff out there. There's a lot of research out there, but it's a matter of putting it all together to create a good comprehensive um, management plan for someone. It's giving them the resources to make decisions for themselves if that's something they want to pursue, if that they want to try something else. But really, as professionals, we're here to offer and really just connect the dots together. So um, Harold, what is your I guess vision for this platform, or vision for explain and change your pain? What is your hope?
My hope is that so there's a lot of people. lot of folks right now, especially during this COVID-19 stuff, which
Mhm.
we don't need to get into right now, but there's been a lot of care that's stopped out of necessity, and I don't disagree with it, but my hope is that we can start to provide means of communication and delivering care, delivering any sort of hope, uh, and I'm speaking broadly first, to anyone who's suffering. And I'm going to use an old definition of suffering that I learned from PT school. Suffering is pain is experiencing um, something that could be dangerous. I'm paraphrasing here, in your body, experiencing something that can be dangerous and um, avoiding that. Suffering is not understanding why you're experiencing pain. Now, there are some tenets from my PT background that I may disagree with, but I don't disagree with this one. I think understanding, at least to some extent, why we hurt, and actually realizing that it's okay to hurt, but we need to find some action to take in knowing what's okay, what's not okay, and where we can live in that zone. I'm hoping that anyone watching this is going to have some sort of insight they can take away from that.
Yeah, I mean, I definitely agree. To some degree, yes, pain is okay, but past a certain point, that's where we want to step in and really provide what our expertise is, and really, like I said, connect the dots and just address the person as a whole. Um, I think for me, it's really just about reinventing the way we approach healthcare, and that starts with reimagining how we approach it ourselves as therapists. So, knowing that there are other healthcare providers out there that have insight to provide information, like whether it's like meditation, yoga, or just other aspects of care, and incorporating it into our own and making it options. I think, that's really what we're here for. And that's one of our hopes. And for this entire platform is just to empower our patients to take control for themselves and to manage their pain and their symptoms.
Did you ever have like an aha moment when you were learning, like even now as a student or as a clinician or with one of your patients, like, oh, this is where we need to start changing things up? Is there a specific case that comes to mind?
Um, I can't think of a specific case off the bat. Um, but what I do think of often is that, patients get better. They get better to the point where they get discharged from physical therapy. But the problem is they keep coming back with the same issue. And I think that's where that cycle continues. And that's where we need to break the cycle, is how do we educate our patients? How do we provide them with the tools that they need to manage their pain and their symptoms on their own, and not have to, you know, go through the cycle of healthcare providers. So, is there a particular moment for you that stood out, or like your aha moment?
Yes, there's one that I remember vividly, and this was after I had sought some extra mentorship and help, but I still didn't really know how to help this person. So under certain insurance plans, and I guess I'm kind of throwing our healthcare system under the bus a little bit, but that's kind of the point. We need to recognize where there are problems and we need to change it. It's not that institutions are evil, but that the way things are set up, it can be clunky, and
Mhm.
we have to start to adapt and we have to be creative. But this person, they were on an insurance plan that just wouldn't fit a model of treatment that we could support for a long period of time. And we didn't have much time to evaluate this person's scenario. I had asked them what they were in here for, how I could help them, and this was the in some areas, we might view this as someone who's just difficult to work with. They sat in the corner of the room, arms folded, and just not opening up. And there's a level of trust that you have to
Mhm.
provide, and that takes time. And I realized that I don't know if I can get this person to open up in one visit, which was the number of visits that I had with it. I don't know if I can get this person to open up in one visit with 30 minutes to talk, or even 15
Right.
minutes as a follow up. I don't think just sending this person home with a list of exercises was the way to go, because this person, when I asked them what they wanted, they basically just told me, I don't want this. And um,
Mm.
that just floored me. I didn't really know how to get more out of this person to the point where I could help them. And I realized that we need to have more resources. We need to have a way of communicating with them that isn't just through prescribing certain exercises, that isn't just through doing an electric stimulation unit,
Mhm.
um, or even what we call manual therapy. And that could be a variety of things like massage or joint mobilization. Those are all tools that we have, but those tools wouldn't necessarily be the panacea. They wouldn't even, I don't even know if they would solve any issues in the immediate term. And that's where having better discussions and just validating these people is going to give us so much of a better result.
Right, I agree. It's really starting off with having meaningful discussions with our patients, and not even just with them, but with our colleagues as well. But I guess with saying that, um, is there any other like questions or anything else that you would like to ask, or maybe just tell about what to, expect from not just us, but from, our Facebook group and, what's
Yeah.
for us?
Um, so my thinking, this is going to be ever shifting, and based on past discussions that Christina, you and I have had together, we've adopted this approach of imperfect action more than perfect inaction. So we're going to constantly be changing and molding things, and that's based on what the need is for people in this group.
Mhm.
The expectation is that we will be able to deliver some sort of answer to questions on that people have, that why am I hurting, what can I do about it. That's the main thing. How long is this going to take? But also bring in experts of their own, in their own fields, to discuss things like sleep and stress and
Mhm.
exercise and diet. um, I can always draw back on my own experiences, but I don't want to be the only mouthpiece here, and I don't think you want to be the only person here either. I think that we have a lot to learn from others, and
Right.
that can be passed over to anyone who's listening here.
Mhm.
The What we'd like to deliver is, ultimately, we want to be able to help you, um, our audience, identify where you're at in your journey, and identify a path that you can follow, so you have some level of direction, and then just be there as mentors along the way and guide you where you need to go. And sometimes that might require uh, more time. And I, we spoke about this. Time is a factor here, that we need to be able to have conversations, and that just doesn't happen in the span of 15 minutes. And
Right.
then
Mhm.
finding the right people. It's an
Yeah.
open forum. Anyone that has questions, struggles, please feel free to post them. It's a safe place. If I find that there's any sort of negative discussion, any spamming, there's not going to be a warning for that. There's no tolerance for that. Anyone who's suffering, they don't need to have that extra burden, especially in a place where they should be they should be able to trust. So that's not gonna happen here.
Right. So really just trying to extend our reach. There's a lot of professionals in our field already that are doing a lot of great work, a lot of great research, and they're doing their part to, I guess, spread the message about, how to approach pain, how to manage pain. And, really just on our end, we want to make sure that we're doing what we can, whatever that may be, to extend our reach and our influence. So, with that, um, any questions or any comments, any ideas?
Yeah, let's take the time to open this up to our panelists and anyone who's late to the party. I know we're not live right now on Facebook, but if you have any questions, you can always ask us. You can directly message either one of us. That's perfectly okay. But based on what we were talking about, or the future of this, or even if you have something specific you want to ask, now's a great time. Or if it's a little more personal, you can find one of us after the meeting and just shoot us a message. So let's open that up. We got Rick and Jeff here.
Our
Hey,
two
guys.
panelists.
Well, it's the first one, right?
Yeah.
So when did you guys come up with this?
When did we come up with this? Maybe about 2 weeks ago. I mean, since we've known each other, I've known him since my last rotation. So since I've known him, we've had really like a very similar philosophy on how we approach patient care. Harold's been a great mentor. He's always shared with me information and, summits and presentations to watch. So, a couple weeks ago, since everything started, he, sent me a text and we kind of just hit the ground running, really. So,
Yeah.
yeah.
I think 2 weeks is about right.
Mm-hmm.
Cristina was I wasn't directly your clinical instructor. I just kind of stepped in those last couple of weeks, but we shared a lot of philosophies, and I thought that at some point in your career, I would like to work with you and try to push our field along, because it's not so much of a hands-off approach to treatment, but recognizing that there are multiple ways to help people, and we have to be open-minded and look at how we communicate, mostly in particular, to deliver effective outcomes, and maybe recognize that we're not delivering those outcomes. We're just allowing our patients to find those outcomes in the way that we set things up.
Yeah, definitely. I think that's the best way to put it is, we provide information and we kind of let you guys, like I said, make of it what you will. But, that's really what our effort is here. All right. Any other questions from our one and only Rick?
Yeah.
Well, you guys open up a lot of thought, a lot of creative ideas, things that I've already experienced in the last 2 years with therapists and people in the field. I'm a private trainer, a yoga instructor myself.
Oh, awesome. Awesome.
And my approach, has changed a lot in the years. I used to train people because they had body parts. And now I'm much more interested in a more of a holistic approach. And like you were discussing, so you're some of what you're saying is really ringing true. I started going to a conference 2 years ago, and I went again this year in the beginning of the year to a company called MedFit, and they have it in San Diego, not San Diego. I forget exactly where it's, down south.
I think you mentioned it was Irvine.
Yes, thank you.
Oh,
yes.
okay.
So at Irvine University, and their whole goal for MedFit is to bring professionals together and create a system that's going to bring people on the same path. So if you're a trainer and you don't know how to handle shoulder rotator cuff problems, or how to handle people after they've been rehabbed.
Mm-hmm.
They want you to get the education, so they're setting up the courses and things that you would take. They want you to be well-rounded, so they've got a lot of things they're offering, but they're still developing that whole system. So I have been reaching out, like, to Harold and other people, trying to establish connections that I can work with, because well, you don't know, but since I told you I used to train people because they had body parts, I got trained as an advantage trainer, it was called, at my club. And we worked with the Egoscue Clinic in San Diego to develop ourselves to become postural assessment and gait analysis specialists, so that we would look at people and see their imbalances. And then we would take that information from assessments and things like that and apply it. We would actually have to give it to the Egoscue Clinic in San Diego, and then they would give us the workout. And so we would do the workout with the client. But the club didn't like that. So what they did was they said, we want you all to know how to do the assessments and to determine what exercises, based on origins and insertions and things like that, what were you doing? Like, knowing that the latissimus dorsi of the lats and the pectoral muscles are all internal rotators. They cause kyphosis, or round shoulders and poor spinal curves. So you don't want a forward tilt. You want to be upright, and you want to be corrected. So that changed a lot for me. And then, of course, going through yoga really integrates a lot, like thousands and thousands of exercises. Yes?
Yeah.
And so it takes thousands of exercises to produce postural corrections without even using weights, which I was all about weights and resistance training.
Yeah.
But now knowing, like, Cobra and Salavasana, or locust position and things like that, where you're expanding and opening up your chest, and you're rolling your shoulders on your back, and you're extending your spine into these sort of back bends, creating the strength that you need to make you upright, help you become upright from within, rather than trying to strengthen muscles that you could overpower things with. So it's really, there's a lot going on. I mean, you guys really give me a lot of food for thought.
Yeah, I mean, that's awesome. You're right. It's like just using and relying on your own body to create, an environment to heal and to, rehab from these injuries without relying on any external, like, weights or any external equipment. So, I mean, that in itself is pretty powerful, I think. Is just you're relying on solely, yourself. So,
Right. And, starting with breath. I mean, people breathe incorrectly for the most part, and you can actually lose an inch to an inch and a half off your waist.
oh wow,
by
I didn't know that.
breathing correctly.
Wow. Yeah.
Mouth breathing, diaphragmatic breathing, instead of mouth breathing, going through the nose instead of the mouth. And we breathe 26,000 times per day on the average. And those people who are constantly, through their lifestyle, are constantly breathing to the strengthening of the muscles of the neck, shoulders, chest, and back, are going to all experience these tightnesses that they're not going to be able. They're going to feel like they're being held down. So when you start teaching people how to breathe in an upright position, or on their hands and knees, or on their back, or even in a twisted position, where they're twisting their body and they're breathing, then start integrating that breathing process. Suddenly, if you're having pain or discomfort in your lower back, suddenly your abdominals are drawn in more secure, and it just, and then they're like, well, I don't like breathing like that. That's not normal for me. And I'm like, you know what? It wasn't for me either. But when I started to practice it regularly for, like, let's say, a couple minutes here, a couple minutes there, down the road, I don't even think about it anymore.
Yeah,
So
I mean,
Yeah.
that's like a beautiful example of it takes consistency. And I think it's like the message for anything is, if you want to see change, you want to see progress or success, it's really, consistency is the name of the game. And now you've given me something to think about. 26,000 times we breathe, and
yeah, on the average, 26,000
Wow.
breaths per day. Yeah, and you think about that. That's quite amazing. I think maybe the only other thing we might do is have a heartbeat.
yeah,
That might go more than that.
Yeah. Well, definitely. I wanted to kind of throw in a quick aside here. I know there's been in my career, and I think in everyone's career as healthcare providers, there's been certain turf wars in terms of chiropractic, massage, personal trainers.
Right,
That
right.
doesn't that doesn't exist to me. Well, it's present, but here, honestly, mm, from what I've seen, you can deliver great outcomes no matter your background. Obviously, you want to have training and you want to have accredited training, and it should be research driven. But when you start splitting hairs and you start lighting dumpster fires online over certain philosophies, that's not right. And ultimately, at the end of the day, it's what gets patients better. And so what you're talking about with MedFit and with being up looking at postural analysis and gait assessment in the past, I need to explain this a little bit. We were trained as PTs to embody this idea that, oh, you're the musculoskeletal expert, you're the experts of gait, and there is no doubt in my mind that as physical therapists, we better know our biomechanics and we better know our gait and we better know how to address postural deficits. But that doesn't mean the door isn't open to anyone else to deliver great outcomes using the same thing and maybe even doing better at it, especially for how long you've been in the game here, Rick.
Yeah, 20, 25, 26 years.
Yeah.
Wow, it's amazing. Yeah.
Something else I wanted to throw out there, and I probably should have prefaced this, is we're still recording right now, and I do want to put this up, not just on our Facebook page, but also put it up in video form on YouTube and on podcast. I should have hit the stop recording button a little while ago, but this is newbie learning how to deal with the online game. Um, are you comfortable sharing this in yourself online, Rick?
Yeah, I
Okay.
absolutely. I actually, through Pierce College, I'm doing Zoom on my own because I have to for them because that's the way they've gone now.
Okay.
And so I'm used to like talking and explaining, and yeah, I don't have a problem with. Oh, you mean like legally? Is it
Yeah.
okay to let this stuff out? Yes.
Yeah. Okay. Okay.
Yeah. Yeah.
So we'll definitely get this up on the air in iTunes. And since you did jump on and you did kind of tell us a little bit about what you're doing, tell us where we can find you for anyone listening.
All right. I have a website that I developed. It's not a very big website, but it's called basicfitness.us. And I am on Facebook as well on a couple of groups. The Calabasas group is something that's it might be closed to some people, so it may not be open to everybody to see. But I am on Facebook, and my I don't know how else other people could find me other than my email, and maybe just um, maybe through events like this, just
Okay.
being on here. I'd love to be able to uh, help out or ask questions when I don't really know what maybe the topic is about, or I'm not really sure about it.
Okay. Well, we'll be sure to drop your website and your email in the video when we post it and in the show notes.
Yeah.
Great.
And I mean,
I
yeah,
teach
definitely.
the yoga I teach for Pierce College is open to the public.
Oh,
Anybody
nice.
can go. You just have to sign up through Encore, and you can go online and sign up. And I have permission numbers that I give people that can get them in at any time they want. Like we're already in like many weeks of class. Last week was the first class that we restarted up on Zoom,
Oh,
and
nice.
so
Nice.
anybody can really join those classes. They just usually have to go to the Encore website, sign up for it, and then they can come in on Zoom and take my class. And there's no
Awesome.
limit, of course, on Zoom. We have an amazing Zoom program through the college. We can have up to 300 people in a class.
Oh, awesome. Yeah, that definitely allows for a lot of people to jump in and start taking your program. So maybe we'll look into it too.
Yeah, and also I can have up to, I don't think I'm not sure there's a limit on the amount of time that I can spend on it. Like I know that basic Zoom has like 45 minutes or so.
Yeah.
My class is set for 2 hours.
Oh, awesome.
Yeah.
Awesome.
So I think you're using like a premium version, but
Yeah, it's called Zoom. It's at zoom.us, and it is a premium one. It's the college's, the college opens the best stuff.
All right. Well, thank you, Rick. Thank you for sitting through the whole thing.
Oh, thank you. No, I didn't. I saw it.
We appreciate it.
I just happened to see on my Facebook that you guys were going to be live, and I said, "Oh my gosh, I'll check it out."
All right. Well, hopefully we can get you in, and then maybe talk a little bit more about yoga and its benefits, also, and kind of do a little segment on that. So.
Oh yeah, I'm open to talk about a lot of things. I do a lot of writing. I do a lot of creative ideas and motivational things for people. Programs. I invented something called the functional life sport training model, and it takes 6 different disciplines to eventually get someone to either from corrective phase all the way up to sports, whether they want to compete or not. So I take 6 different disciplines. I don't really look at it as health and fitness, but more of wellness, more of a well-balanced approach.
Yeah, and that's probably the best way to look at it is wellness.
Yes,
100%.
yeah. You said holistic, yes.
Okay, that's a pretty successful first run here. We'll try to pop on once a week maybe, or once every other week. We'll definitely give all of you guys a notice on when we're going to come on live. So if you want to jump on with us, then we'll always put the invitation link down below in our Facebook group. And hopefully by then, we'll have figured out how to synchronize the webinar with the Facebook Live.
Yep, that's the dream.
That's the dream.
That's great. Thank you.
All right. Thanks for listening and watching.
All right. Take care, guys.
Take care.